Hello friends, this is Dr. Sushanta Bhanja, your Pediatrics Super Specialty Faculty of Atoms Learning. Today, I would like to discuss the recent pattern question of Pediatrics Super Specialty 2023. Before that, there is a disclaimer. The question of this discussion on pediatrics are based on the topics which have been asked in recent year exam. We do not claim them to be the exact or similar questions which have been asked in NEET-SS. Any resemblance to them is purely a coincidence and by chance. So, let's see how is the pattern in this year. There are some clinical case scenario along with a lot of image-based questions, okay, and a less number of one-liners. So, the most important one, that is the image and clinical case scenario based question, was asked in this exam, and most of the image came from derived from Nielsen's. So the question derived from Nielsen's along with the clinical picture came from the Nielsen's. Okay, so other than around 80 to 90% question came from Nielsen. Other than Nielsen is not enough. A few questions. Forget about this. Okay, so let's start the questions asked in this exam. The first question: Metformin is approved for which condition? The options were growth hormone deficiency, IGF-1 deficiency, IGF-2 deficiency, and insulin deficiency. So the exact answer is the metformin is used for FDA approved for IGF-1 deficiency. So it is written in Nielsen's. Okay, so IGF-1, the recombinant IGF-1, that is the metformin, is approved for use in the primary IGF-1 deficiency. This is the line. What is the route of the metformin? It is subcutaneous route and given twice a day. Okay, and the side effects, the common side effects, that is hypoglycemia. Okay, and however, metformin is not indicated in the treatment of majority of patients with growth hormone deficiency. So it is useful in the primary IGF-1 deficiency. So this is a new question. Next question: Nusinersen administered by which rate? Intrathecal, intramuscular, IV, and intradermal. The exact answer is intrathecal. In the previous exam, the nusinersen was asked about the indication of nusinersen. So the nusinersen is indicated in, it is a SMN antisense oligonucleotide administered intrathecally, and it is FDA approved, and it is indicated in all type of spinal muscular atrophy, that is SMA. So previously it was asked for indication of nusinersen. Now it is asked for what is the route of nusinersen. So the route is intrathecal. This is very, very important, and it is useful in the all type of SMA. Great. So moving to the next question. This was the exact picture given from the Nielsen. A child presents with following eye abnormality. See the abnormality. Which of the following statement is correct regarding this eye finding? What is the eye finding? So the option A, mostly located in superiorly, does not involve the fundus and optic nerve, frequently transmitted as an autosomal dominant trait, and no need for further evaluation. So what is the diagnosis and what is the answer? The diagnosis is, it is coloboma. So it is coloboma. Okay. So what is the coloboma? That is the embryological lesions. It is the embryonic fissure fails to close completely. Coloboma is the defect, also known as keyhole pupil. And the important one is mostly located in, it is not superiorly, it is inferiorly. So the coloboma is always located inferiorly. Okay, that's why keyhole pupil is there. That's why keyhole pupil. So inferiorly. That's why it is not the answer. Does not involve the fundus. Yes, it involves the fundus and optic. There is a optic nerve. So again, it is not there. And frequently transmitted by autosomal dominant inheritance. This is the answer. It is written clearly written in Nelson. And there is no need of further evaluation. No, there is need of further evaluation because there is association with the optic nerve and other eye abnormalities. So the further eye evaluation is needed. That's why the answer is frequently transmitted as an autosomal dominant trait. So that a typical question from the line given from the Nelson. Now, moving to the next. Another question which was previously asked in the different form. Now, so the topic is same. You should read the topic. So what is the question? The apple pill appearance is seen in which type of jejunal atresia? Type 1, type 2A, type 2B and type 4. So it is, the answer is apple pill appearance is seen in type 3B. Okay, so the answer is type 3B. There is jejunal atresia, the commonest site of intestinal atresia in neonate, and it is due to the intrauterine vascular accidents, whether duodenal atresia result from failed recanalization of the intestinal lumen during gestations. The types of jejunal atresia, there are type 1, type 2, type 3A, 3B and 4. Previously, the question was asked with this image, that is the least common type. Okay, the least common type, that is 3B, and that is the apple pill appearance or Christmas tree appearance. So the 3B is important for MCQ. That is, this is the least common type, 3A is the most common type, and 3B is the least common type, and apple pill appearance or Christmas tree appearance. Okay, so that is 3B. So this is the answer. Now moving to, and what is the X-ray finding of the jejunal atresia? That is triple bubble sign. Okay, clear? Now moving to the next question. This is the typical question. A newborn infant was born with this scalp defect. This is the scalp defect. The mother reports that the baby turns blue and has difficulty breathing when she tries to nurse him. Physical examinations shows an actively crying baby who is in pink all over. When the baby attempts to suck on gloved finger, he turns cyanotic. Mother received a drug antenatally. Among the following drugs, which is responsible for this condition? What is the antenatal drug which leads to this condition? So what is the options given? This is the picture along with this clinical case scenario, and the option is propranolol, carbamazepine, valproate, carbimazole. So what is the diagnosis? And there is scalp defect, that is aplasia cutis. This is the diagnosis, aplasia cutis, along with the clinical case scenario, that is choanal atresia. Because during breastfeeding there is difficulty of breathing and the bluish, that is cyanosis. Okay, so it is nothing but the choanal atresia with aplasia cutis. So this is caused by the teratogenic effects of this carbimazole. So C for carbimazole, C for choanal atresia, C for cutis. So this is the all about the, remember C. That is the C for common congenital anomaly of nose. Carbimazole is the offending choice. Charge syndrome associated with C is the clinical picture cycles between silent cyanosis and cry. Catheter investigations. The catheter is inserted only for 3 to 4 centimeter. The McGovern open tip nipple method is employed, and the mitomycin C prevents the stenosis. So this is all about the choanal atresia, that is the C for C, most common, that is the congenital anomaly of the nose. Okay, and this is all about the clinical case scenario. Now next question. So this is the typical question, but there is some controversy I will discuss later. The question with this image, 1-year-old child presents with severe short stature. His birth length was short, and there the child was short limbed with short, that is short birth length, and the resting and also stimulated growth hormone levels was high. In the recall, few students told that there is a normal growth hormone, so there is a controversy, but the picture is looks like the diagnosis is confirmatory. That is, while insulin like growth factor level is low, IGF level is low, and growth hormone stimulation level is high, growth hormone is high. Of the following, most likely diagnosis is, so it is nothing but, that is IGF low and growth hormone high. That means the growth hormone resistance. Growth hormone is there but not acting in the receptor. So that's why, and the child presents with this short stature and this typical feature. So it is nothing but Laron syndrome. So this is the condition, Laron syndrome, and this was given in image in the internet. So Laron syndrome with case, that's case reports. So it is, the diagnosis is Laron syndrome, IGF low along with high growth hormone. Okay. So the typical line, the Laron syndrome is a mutation of the growth hormone receptor. The birth length is below the about 1 standard deviation, and the child may present with severe short stature more than 4 standard deviation below the mean presented by 1 year of age. And there is resting and stimulate growth hormone level tends to high, but IGF is low. So this is the picture. Okay. So answer is Laron syndrome. Now, a 18-month-old child diagnosed a systemic juvenile idiopathic arthritis, that is psoriasis, 1 month ago and is in remission with treatment, and today presents with high spiking fever, lymphadenopathy, hepatosplenomegaly, purpura, encephalopathy. Laboratory evaluation shows thrombocytopenia, leukopenia, hypofibrinogenemia, but with low ESR. This is the important point. Of the following, the most likely diagnosis. So there is two diagnoses. It is confusing with this clinical case scenario. Either there is psoriasis is flared up in this condition, or there is a macrobar activation syndrome or high hemophagocytis lymphohistiocytosis, HLH, or macrophage. What is the difference between this psoriasis flare and that is mass? In mass, there is ESR will be low. Okay, so ESR is low in this clinical case scenario. Then that's why it is hemophagocytosis, lymphohistiocytosis or mass, not the flare of the systemic disease. So this is the answer of this question. Okay. So answer is hemophagocytic lymphohistiocytosis or macrophage activation syndrome. The ESR falls in macrophage activation syndrome because of the hypofibrinogenemia and hepatic dysfunction, a feature useful in distinguishing mass from the flare of systemic disease. So this line is from Nelson, and it is very, very important. Okay. Now moving to the next question. These are the questions asked on the Down syndrome along with transient myeloproliferative disorder. You are explaining about the TMD, that is transient myeloproliferative disorder in a child with Down syndrome to patient relatives. What is the true statement of this following? The number one, less than 1% of neonates with Down syndrome develop a transient myeloproliferative disorder. It is not right because more than 10% it is. Gata mutation seen in blast cell. Yes, in TMD, Gata mutation is seen. Intense chemotherapy is required for treatment. No, it is spontaneous recovery is there, and chemotherapy is rarely needed. Less chance of development of AML in later life as compared to normal population. No, it is a more chance of development of AML than the normal populations. So here the Answer is the GATA1 mutation seen in the blast cells. This is the answer. Now, next. A child presents with feature of Alport syndrome with macrothrombocytopenia. There is a picture of Alport syndrome, that is the anterior antigonus, hematuria, and the sensory neuron hearing loss, along with thrombocytopenia. This disorder is due to the mutation in COL4A1, A5, A6, and MYH9 gene. So, what is the diagnosis? Alport syndrome with macrothrombocytopenia, that is Fechner syndrome. Okay, so Alport with Fechner syndrome is the diagnosis. Okay, so here the Fechner syndrome is an autosomal dominant disorder and it presents with Alport-like syndrome along with macrothrombocytopenia. And here the mutation is MYH9 mutation. So this is the previously asked questions, that is the MYH9 mutations. This is very important. So Alport with macrothrombocytopenia is a Fechner syndrome. It is autosomal dominant and MYH9 gene mutation is there. The next question number 10, that is the ask on the staging of the HIV. A newborn baby required positive pressure ventilation for birth asphyxia. Within 6 hours of life, the child developed lethargy, and on pupillary examination, there was meiosis. What is the stage of the HIV of this baby? HIV 1, 2, 3 early, and 3 late. So here in the Sarnath and Sarnath staging, we should remember a very simple trick. Stage 1 is mostly adrenergic activity, that means there will be hyperalert and mydriasis, and stage 2 there will be lethargic and that is cholinergic activity like manifestations, that is meiosis. So here in this case meiosis along with the lethargy, so it's more probably HI2. Okay, so moving to the next question. 4-year-old white girl has had a low-grade fever, intermittent crampy abdominal pain with emesis, swelling of the knee for 3 days. There is a petechial rash on the lower extremity like this. So this is likely palpable purpura. Along with this, the kidney biopsy, that is IgA deposition. So what is the diagnosis? So it is nothing but that is the HSP, choline purpura, because palpable purpura with IgA deposition. So it is most likely HSP, honest choline purpura. Okay. Moving to the next. This is a question. New question. In enzyme replacement therapy, the patient's antibody response does not affect the treatment's efficacy in which condition? Pompe's, phenylketonuria, Fabry, and culture disease. This is the typical line taken from the Nielsen. So the antibody response does not affect the treatment's efficacy in Gaucher's disease. This is the answer. So what is an enzyme replacement therapy is available in which condition? Gaucher, Fabry's, that is lipase deficiency, okay, and Pompe's disease, okay, some MPS, mucopolysaccharidosis, that is these are the acid lipase deficiency, and mucopolysaccharidosis like 1, 2, 4A, and 6, and they are being tested for 3A, MPS, 7. Metachromatic leukodystrophy, monocytosis, Niemann-Pick B, neural ceroid lipofuscinosis, late infantile, and hypophosphatasia. So these are the trial testing is going on. Now, what are the complications of enzyme replacement therapy? The major important, that is the antibody response to infused recombinant enzyme. Recombinant enzyme is the major complications, antibody response. This response depends on the type of the enzyme used and the the disease. In most cases, the patient's antibody response does not affect the treatment's efficacy like in Gaucher's. But in other situations, it may be significant hurdle in Pompe's and phenylketonuria. So, here the answer is clear. That is the answer is Gaucher's disease, and it is from taken from nature.